Hello and welcome to Talking Mental Health. I am your host, Allison. Talking Mental Health is our new segment from the Wellness Project, where I interview mental health professionals on all things mental health and wellness as they relate to college-age young adults. Today I'm here with Dr. Michelle Mitchell. Dr. Michelle Mitchell, do you mind introducing yourself?
Sure. Hi, everybody. My name is Dr. Mitchell. I'm an assistant professor and clinical director here at Jacksonville University in the Department of Clinical Mental Health Counseling. So a little bit about me. I have my master's degree in clinical mental health counseling and a PhD in counselor education and supervision. And my clinical base and research areas really focus on multicultural issues in counseling. I also have experience working with persons that are exploring spirituality in counseling. And I have some clinical base in working with persons that have been diagnosed with severe and persistent mental illness. That would include depression, bipolar disorder, but for the most part, my time has been spent the last several years developing and training future counselors that could potentially be your therapist.
Yeah, I'm very excited for Dr. Mitchell to be here today, and I'm super looking forward to this conversation. We're going to be talking about cross-cultural counseling, what that looks like, some issues that people face within it, and just like starting off, honestly, I had such a hard time trying to discover where to start today, what questions to ask, and how to get there. So I'm looking forward to this conversation. And if you're ready, Dr. Mitchell, I'm just going to go ahead and go into it.
Yeah, let's do it.
Yeah. So just to start off with kind of a broad question, what is cross-cultural counseling?
Yeah, that is a great question, Allison. So basically, cross-cultural counseling is two or more persons engaging in counseling that are different from one another culturally. And so that difference could be based on race, it could be based on age, it could be based on sexual orientation. Honestly, it could really stretch the gamut, but there is some sort of cultural difference. And so when you think about that, all counseling is cross-cultural counseling. I think it becomes more obvious sometimes when we can visibly see our difference. So maybe you are significantly younger than your counselor or your therapist, or maybe you have a different gender identity, or maybe you're a different race. But honestly, anytime you're in a counseling space, it is cross-cultural counseling.
That's interesting too, because I think in my mind, I was dividing it so far from just like counseling, cross-cultural counseling, but thinking about kind of those things you were just saying, that you're almost always in that situation, is super interesting. Which might make my next question a little weird, but I'm going to ask it anyway. I just throughout this project, the Wellness Project, have sat down with mental health professionals for different reasons within Talking Mental Health, outside of Talking Mental Health. I'm curious, throughout some of those conversations, we've gotten into places, and honestly, kind of my classes in school, we've gotten to these places where we were like divided. You know, some people believed that when it came to counseling, you should be counseled by someone experiencing your culture. And some people were like, you know, just find a counselor, that's what matters. And so I'm just kind of curious your thoughts there.
Yeah, it honestly is about preference. And so some people feel a little bit more comfortable going to a counselor that identifies similar as they do. So, in some of that has to do with their comfortability based upon their own identity. So maybe they want to be able to talk about experiences with a shared understanding. So if I identify as a female, maybe there are particular things that I have going on through my life that I don't want to kind of unpack with a male counselor, right? Some people feel very comfortable with that. Other people would really like a different perspective and feel more comfortable talking to somebody that is slightly different from them for a variety of reasons. I've honestly encountered different counselors as well as different clients that have their own preferences for their own reasons. Some of those things also have to do with presenting concern. And so maybe you have experienced, I don't know, intimate partner violence or something along those lines. Sometimes clients also have preferences based upon the reason that they're coming to counseling, or maybe some of their past experiences. And so it really is up to the person. My own personal opinion and professional opinion is, honestly, finding a good counselor that you feel comfortable with sometimes takes a little bit of time, but once you find that person, it might not be the person that you imagined. They may not visibly present the way that you have imagined in your mind, but be open to the process. Even if somebody does not identify similar as you do,
Mhm.
you still can have a really healthy and wonderful, vibrant, healing experience in those counseling sessions. And even if you do find a counselor that identifies similar as you, that also doesn't mean that they've had the same experiences as you. So
Mhm.
either way, stay open to the process and open to whatever that person is in front of you has to say, and the healing that you can get from the journey.
Yeah. I kind of want to name something you just said that's a little bit outside of like cross-cultural counseling.
Sure.
You kind of mentioned in there briefly that aspect of it may take time to find the right therapist.
Yeah.
Yeah, I just feel like sometimes you hear like these stories of like, yeah, I'm going to therapy, but I don't think it's working. I'm not clicking with my therapist, but I often think there's this like small part of a person where you're like, but I can't switch. I've already started with this therapist. This is where
Mm.
I'm at. And so I love that you named that. Sometimes it can take a while to find the right therapist for you.
Yeah, it's all about fit. And so the fit can come in so many different forms, Allison.
Mhm.
Honestly, it could be, we're talking about cultural identity. That could be one level where you're like, I'm not really that comfortable. Maybe
Mhm.
in coming here, I realize I need to talk to someone that's slightly different. It could be their modality, right? It could be
Mhm.
their theoretical lens in providing you with care that just doesn't quite match up. And sometimes you don't know that until you spend a little time in session. A lot of students, whether it's undergrad or grad school, have to go through an internship experience. And
Mhm.
my experience in talking to students that need to go through those experiences is that you want the perfect experience the first time out. Very similar to counseling, I talk to students in this way. Sometimes you go through the experience and you learn what you like and you don't like. And that's part of the learning, that's part of the growth, and that's part of the learning opportunity. And so, I learned in my undergrad experience that I don't like sitting behind a desk. And so I didn't take that job full time, but I figured out kind of what I do like based upon what I didn't like. The same could be said with finding a counselor.
Yeah, thank you so much for sharing that and adding that little aspect. I know it was a little off from like our original conversation topic, but I just think it's so important to talk about.
Yeah, no problem.
So I'm curious, like within your own practice, what are some of the issues seen when it comes to multicultural counseling?
Oh, all over the place. And so I would say with college students, the biggest area is identity development, and that could be identity development in a number of ways, right? And so
Mhm.
race, ethnicity concerns, I know that has been societally a big thing.
Mhm.
Really either learning more about it or trying to find a space to kind of navigate different things that people are experiencing at school or at work. LGBTQ, gender identity issues, spirituality issues or concerns, also acculturation issues. And so, especially during this prime time in students' lives, figuring out, do I believe and hold the same values as my family?
Mhm.
Am I diverging from that just a little bit? What do I want to keep? What do I want to shift? Those are all issues that come up. Also, access to care and services and destigmatizing mental health, which this is obviously a wonderful platform for. So, when you think of access, that could be physical access to mental health services. I think that our field has grown leaps and bounds in the last like 5 to 10 years. So, you
Mhm.
have online platforms like Better Health and things that have provided, and we have had some legislation that has really assisted us in providing telemental health in a variety of states, including Florida. But you also have rural communities that need more access, but also destigmatizing mental health for certain communities. So when we think about certain race, ethnicity groups, it still is an ongoing process to have the conversation about how it's okay to seek out mental health. You don't have to be considered
Mhm.
crazy. And so those are all ongoing conversations and things that are being discussed in the counseling space.
Yeah. You mentioned culturally, going to college and kind of straying a bit from like the beliefs and the values and all the things you grew up around.
Yep.
I'm curious because I have seen that happen with lots of people I've been around in school, outside of school, friends, acquaintances of like this, well, you went to college, college did it, college changed you. And I'm curious just like your thoughts. What does somebody do in that situation?
How to navigate that with their family.
Yeah.
Yeah, that's a tough one. And so part of it might be about having gone to college and being exposed to a variety of knowledge, but also people. But a lot of it is just it's a prime time in your life to try and figure out, especially your late teens, your early 20s. You're going through a lot of development and trying to figure out who am I, right?
Mm-hmm.
So we could talk about very surface things like how do I want to dress? That tends to be an ever shifting thing around that time as well. But what do I really care about and what do I value? I would just say having clear and honest conversations with yourself. So obviously I would promote counseling as a space that would be really helpful to unpack that for yourself first. Journaling can be really helpful. And your counselor could potentially provide you with some activities to kind of figure out where you land on these things. But I would strongly encourage for a person to attempt to kind of go on a journey with themselves before having a conversation with parent, or you could do that together. You could have those conversations together. But depending on what we're talking about culturally, families may or may not be as accepting to some of those differences, even if those differences don't seem to be really, significant. So I can say for me, it didn't seem to be really significant that my diet changed a little bit when I went to college. And so I became a little bit more health conscious. I was a public health major, but I got a little pushback from my own family in that regard, right? I come from a family that likes to cook and come together and eat certain foods around holidays, and that represented something a little bit more than food. And I didn't realize that at the time. But it took a little time to discuss my reasons and health reasons and wanting to sustain myself for a long time, right?
Yeah.
And eventually family has come around, but I can say the same thing about having discussions about mental health. It has been a slow process of continued conversation and education about what is mental health, what is it not, what is counseling and therapy, what is not counseling and therapy. It has taken a little while, but family has kind of come around. So I would say if you're having those conversations and you're figuring out who you are apart from your family and your family is a little resistant, give them a little bit of time to kind of come around and continue to provide them with some educational resources. And if they are open, coming to a counseling space with you and unpacking that in a session would be really helpful.
Yeah. Thank you for that. That was such good information too. And I appreciate like the personal touch you added there, because I think it kind of helped understand a little bit where that information's coming from.
Sure.
To circle back a little more, you kind of mentioned this like idea of like in some cultures, therapy, it does have like a stigma to it.
Yeah.
Going to therapy, seeing a counselor. And I'm curious, do you think there's any relation to that and like that parent guilt of you're in therapy, it must be my fault? Or are those like unrelated?
They can be. It's almost like a Venn diagram. They can be related. They don't have to be related.
Okay.
I know in say, for example, the African American community, right? And so that might be some of it. That might be some of the stigma around counseling is, oh my gosh, are you saying that I did something wrong in my parenting? But some of it is historical. Some of it is cultural, and how, especially for the Black community, we have experienced health professionals, and that has extended to mental health professionals. That part of that history has nothing to do with parenting style or, how someone is being reared. But I do believe that for some cultures, that is about, keeping face, right? And making sure that you represent your family or your culture in a positive way. And so admitting that someone maybe needs a little bit of assistance could potentially, create an issue in certain cultures. But it becomes really important to realize that we all need help. We all need help. And there is no shame in seeking out that help. And so in the same way that it's okay to go to a medical doctor if we have an ailment or if something is hurting us and we're not really sure why, it's the same way with seeking out mental health services and counseling, in that if we identify that something isn't quite right, we might not even be able to put our finger on it. It is okay to see someone and speak with somebody.
Mm-hmm. I love that phrase you just used. It's okay to speak with someone, to see someone. Because I just feel like that's part of what we're trying to normalize here. It is okay to go to therapy. It is okay to talk to a counselor.
Yeah.
And I feel like too, there's the more conversations I have with like my friends or people, just people within my community, that it's becoming so normal to just say, yeah, I went to therapy yesterday,
It is so much better than it was 10, 15 years ago. And so my hope is that it continues to progress in that direction.
Yeah. I'd like to move to kind of a different side of this topic. And you kind of mentioned this briefly in our little pre-interview before we started recording. So this is where my idea came from. But with different cultures comes different religions, different types of spirituality. And I'm curious how that plays a part within counseling.
Yeah. So it can play a part if the counselor and the client talk about how that impacts, their everyday life or their presenting concern. I provided counseling services within a church for several years. And the church was a Christian church, but I would ask at every session, right? And so it could sound like this. I know that you've come here for, because of your relationship. And so I'm wondering if you would like for me to integrate spirituality in our sessions with one another. The client may say yes, they may say no. That is ultimately their choice. And it didn't have to come from a Christian perspective. And so I had clients that identified from other religious contexts, and it was, totally fine. So I might ask, okay, so when you think about love, right, we're talking about a romantic relationship because people like to talk about their relationships. I know that you wanted to integrate spirituality in that. And so I'm wondering, from a spiritual perspective, what does love mean to you? Like, what does your faith say that it means? What do you believe that it means? So kind of getting at some of those core values and beliefs and underlying things and saying, okay, so this is what you believe over here. Okay, so what's happening over here in your day-to-day life, right? How does that show up in your relationships? And so really kind of, getting at some of those spiritual concepts with clients can be really powerful for them, especially as they're trying to navigate everyday relationships or their relationship with themselves, trying to unpack and better understand that relationship within them.
Yeah. Gosh, I'm just taking in kind of the last bit of what you just said there, because I think it was very powerful, kind of the way you explained it. Yeah. Well, I do appreciate you being here with us today. I don't know if I have any more questions based off of all of this, but I think I've got some really good information, because there's just so many aspects of counseling and therapy and all the things. Oh, I did want to mention, I knew there was something. I was trying to remember what it was. I appreciate you sharing examples of what could happen in a therapy room, because you had in that end a couple of this is what it could look like. We sit down and I ask this question. And I feel like that's important to share as well, because the people who are debating going to therapy but are afraid of that next step don't know what's going to happen in that room.
it can be very scary if you don't know what's behind the door, right?
Mm-hmm.
And so oftentimes what we see is that persons that are new to counseling, I mean, it usually, and I tell my students this, it usually takes a person a lot of time and energy just to make the call for the appointment, right?
Mm-hmm.
And so that takes a lot of energy, especially for someone that has never been to counseling before, doesn't know what to, to expect or to anticipate. Do I lay on the couch? Do I sit on the couch? Where am I supposed to sit? I mean, all these things can be really anxiety producing. And so I like to give examples. I think that's the teacher in me. With my students, but also, like you said, with potential clients, to understand that just like you and I are having today, it is merely a conversation. It just so happens to be a conversation about you. But that's the wonderful thing about it, right? Is that you know that when you're sitting down with your counselor, you are receiving focused, identified time that is just for you. And it's a safe, confidential space where you're able to unpack the things that you might not be comfortable sharing with your other friends or your family members or your significant other. And so going in with an open mind and allowing yourself to kind of just experience what is in front of you as a college student or else, or however you are, wherever you are in your life, can be really helpful and impactful.
Yeah. Well, thank you so much for being here. I enjoyed this conversation. I am so excited for this to go into a live episode just because, I mean, even I've told you this with you before we started. I think I've mentioned it since recording. I didn't know where to start with the topic. And I think that just shows this like need for this conversation to be out there, to be had and to be made known. So I'm very thankful for you being here today.
Thank you.
Yeah. So bye, friends.
Bye.